Welcome to Health Matters, brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. This video is for informational and educational purposes only. It is not intended as medical advice and should not replace consultation with a qualified healthcare professional. Always seek the guidance of your doctor or other licensed medical provider regarding any questions you may have about your health or medical condition.
Hi, my name is Kayla. I'm a registered nurse and a family nurse practitioner student at Southern Illinois University in Edwardsville. I'm going to talk with you today about diabetic foot exams and why they are important. I will also demonstrate how to do a foot exam to help better incorporate it into your routine visits with patients. Foot exams are important for early detection of ulceration and prevention of infections and amputations. Patients with diabetes are at risk for peripheral neuropathy, which is damage to the nerves, and peripheral vascular disease, which is damage to the blood vessels. These can make it hard for these patients to feel when they have a cut or blister on their feet and impair wound healing, putting them at higher risk for ulcerations, infections, and amputations. Patients with diabetes are also more likely to have thicker nail growth on their feet, placing them at higher risk for ingrown toenails, leading to infections and amputations. Performing foot exams can catch these problems before they become bigger problems. The CDC recommends an annual comprehensive foot exam done by a healthcare professional for every patient that has diabetes. Every 3 to 6 months is recommended if the patient has trouble managing their blood sugars or blood pressures, or if they have had a previous foot issue. Any patient that is overweight or over 40 should be considered for a foot exam. Patients should also be educated on how to check their feet daily with a mirror or have a friend look at them. Let's get started with the exam. Visually assess the patient's legs and feet. What we are looking for is any deformities to the feet and or toes, any changes to the color, texture, or integrity of the skin or nails, as well as any thickening or discoloration of the nails. Any nail issues should be referred to a podiatrist for trimming. Redness or swelling of the foot could indicate a possible infection. Loss of hair or shiny skin on the legs could indicate a vascular issue. Make sure to look between the toes to see for any cracks, moisture, or fungus, and inspect the sides of the feet looking for any redness or calluses that could indicate tight or improper footwear. Palpate the post-tibial pulse behind the ankle and the dorsalis pedis pulse on top of the foot to ensure proper blood flow to the foot. Any abnormalities should be further investigated. Feel the temperature of the foot. It should be warm. If it is abnormally cold, then this should be further investigated as well. Consider doing an ankle brachial index test to check blood flow. Check the blood pressure in the arm and compare it to the blood pressure in the ankle to help detect peripheral vascular disease. Consider a referral to a vascular specialist if you suspect the patient has any issues with blood flow. We'll assess the patient's protective sensation using the 10-gram monofilament tool like the one I have here. Reassure the patient that the monofilament is made of plastic so it will not hurt. Have the patient close their eyes and use the monofilament to touch the patient's foot in several spots along the bottom of the foot and across the top. Ask the patient to say yes when they feel the monofilament touch their skin. Press the monofilament against their skin gently but hard enough to bend it at the tip. The American Diabetes Association recommends testing at least 4 sites with the monofilament. On the plantar surface, the bottom of the foot, testing locations include the pad of the 1st, 3rd, and 5th toe, the 1st, 3rd, and 5th metatarsal heads, the medial and lateral midfoot, and the center of the heel. On the dorsal side, test between the 1st and 2nd toes. If the patient can feel all testing sites, then the test is negative. If they cannot feel even one location, then they need to be referred for further testing. If time allows, you can also assess neurologic function by testing vibratory sensation using a tuning fork. Assess if the patient has any gait issues. Have the patient walk away from you and then towards you while you assess how they walk. This step is important to ensure they walk normally and have proper footwear. This completes our exam, so be sure to document all findings in the patient's chart. I hope this video was helpful. Thank you.